Good morning, my name is Steve Davis and I'm pleased to be the moderator of our Navigating Sarcoidosis webinar. The Life and Breath Foundation is proud to present a panel of experts who will lead a discussion regarding the path of those patients who struggle with the disease sarcoidosis. Each of our panelists brings a unique set of skills and expertise to the treatment and management of sarcoidosis. As President and Medical Director for Greater Baltimore Medical Associates, Dr. Mark Lamos recognized the need to better care for medically fragile patients with complex clinical conditions. He led the transformation of his group to a patient-centered medical home model that better facilitates the integration of primary care and specialists in the treatment of his patients. Irina, Koyfman, nurse practitioner and director of Transitional Care Program for Maxim Healthcare, is an expert in coordinating clinical, psychosocial, and post-acute care activities for patients that are most susceptible to hospital readmission. She brings a unique viewpoint to the challenges clinicians and patients face in coordinating care in the treatment of a complicated disease. Sean Hull, a successful wealth strategist, is the founder and president of the Life and Breath Foundation. Sean was inspired to honor his mother, Ida, who passed away suddenly after a long and unknown battle with sarcoidosis. He started the foundation to help others in memory of a woman who had dedicated her life to helping and supporting others. And joining us via Skype is Dr. Edward Chen, pulmonologist and critical care physician at Johns Hopkins Hospital. Dr. Chen specializes in pulmonary diseases including sarcoidosis and interstitial lung disease. He was also the lead investigator in a study of one of the suspected causes of sarcoidosis. Today's webinar will provide patient information on how to approach and manage challenges of coordinating the care, procedures, tests, treatments, and medications that come with the treatment of sarcoidosis. We will also educate patients and their families on cutting-edge research, diagnostic tools, and the latest measures to coordinate their care. Good morning to everyone, and thank you so much for being here.
Good morning.
Dr. Lamos, why don't we start with you? What should a patient do when he is initially diagnosed with sarcoidosis?
Well, it starts out very simply. In my opinion, you first have to decide whether you're symptomatic or not. More than 50% of the people with sarcoid are told they have sarcoid because of a result of a test done for a different reason. So if a person is immediately symptomatic with their disease, my experience has been that we need to focus on that problem principally. The ones that are asymptomatic, we can take a little bit of a breath and try to figure out the best path. So if a person has pulmonary complaints, shortness of breath, and that was the reason why they came, we have to facilitate quickly the initiation of treatment and more specific diagnostic procedures to make sure that the diagnosis of sarcoid was correct and that the appropriate treatment is begun. What should they do if there are more than one organ involved? Well, first you focus on the organ that has greatest involvement. And since we all know that sarcoid can involve virtually any tissue in the body, the ones that are life-threatening are those of the brain, the heart, the kidney, and the lungs. If these diseases are kept first and foremost in our mind, we can then get them to the appropriate person to help walk through the group of tests necessary to be sure that they're cared for correctly.
Dr. Lamos, should patients leave it up to their primary care physician to make recommendations, or should they immediately start looking for a specialist?
Great question. Again, it depends on the symptomatology of the disease. If a person is diagnosed because of pulmonary complaints or heart or neurologic disease or the ones I spoke about earlier, they do need to see a specialist, and their care needs to be directed in a very specific way so that their treatment doesn't cause complications associated with just the treatment of the disease. More than half the patients with sarcoidosis will have the disease resolve spontaneously if they were asymptomatic at the time of presentation. Those that are older or have multi-system complaints, lung disease or heart disease or neurologic disease, have a high rate of complication, and those patients will need to be guided to the appropriate person. The question about should it be them, the more educated you are about this disease, the better you're going to do. And that's what I hope we can give you from this webinar.
Dr. Lamos, I have a question. So if a patient discovers they have this disease, do you find oftentimes they come in with a blank look, maybe scared of this unknown?
Sure.
And what conversations do physicians have with those patients? Sometimes our patients that have sarcoidosis are faced with a physician that doesn't have any patients with the disease or has very few. How can that patient, I guess, be prepared in those particular situations to seek the right direction?
Well, I think the first question to ask is, have you ever taken care of a patient with sarcoid before?
Right.
That's first.
Sure.
The second thing is, be very nervous if someone hasn't taken care of quite a few of them.
Right.
The second question is, in the process of making the diagnosis, there are a lot of tests that are performed, and many times those tests just have a frightening tone to them. They're being tested for tuberculosis, they're being tested for fungus. Somewhere along the way, someone has talked about malignancy or cancer, and someone has to help them walk through those initial steps. So, one, have you taken care of somebody before? If you haven't, who do you know can best help me work through this? If you have experience, then they got to start out with a group of questions to make sure that you can define which organ systems are involved. And then, because of the difference of treatment in different organ systems, or the decision to treat it all, okay, you need to make that crystal clear. I think we have spoken in the past about the idea of patients directing the conversation.
Sure.
So I really believe that they need to open up a book, open it up and say, "Hi, Dr. Lamos, I'm seeing you today," and she writes the date at the top. "This is what we talked about today," and literally make her record. When he makes suggestions, he writes it, she writes it, or he writes it in their book. When they go to see anyone else, this book follows them everywhere they go, because not all systems are yet equipped to be able to manage the volume of information that a complex sarcoidosis patient has.
It seems like following that recommendation would maybe allow the patient to condense down the diagnosis period. Oftentimes, patients have reached out to the foundation to say that the diagnosis period has been anywhere from a year to 2 years.
Yeah.
And being able to condense that down a little bit and get the direction a lot earlier may give that patient a lot more positive results.
Well, I'd agree with you. The most common ways this disease shows itself are either a group of seemingly unrelated symptoms, everything from a nerve weakness in the face, or a problem with an eye, or a skin rash that didn't resolve that somebody got around to biopsying. That's that unusual patient. The common one is we did a chest x-ray for a reason we didn't expect. We thought it would be normal, and lo and behold, there is this abnormality. Those are very different. And you need to be empowered as the patient to walk with this data from one person to another, and not expect that the secretary is going to be picking up the phone to call the dermatologist, the pulmonologist, the heart doctor. They got to walk around with it and say, "I have my records with me. My doctors have given it to me." If they're really lucky, they're part of a system that all of this data is in one place, that they can go and say, "Dr. Smith, please take a look in the portal, everything is there." Or look in the common record that we all share, everything is one place or another.
So that kind of leads to Irina, because assuming that multiple doctors are involved, how can a patient try to assure that they're talking and that results and tests and things like that are being shared?
First of all, thank you for having me, and a big thank you to Sean and Life and Breath Foundation for putting this webinar together. I hope that with our help, a lot of people will feel just a little better about coordinating their health care. Dr. Lamos, I agree with you 100%. I have actually even brought a little book that Sean and Life and Breath Foundation is working on putting it on the website. It's called Personal Health Record. The name of the book doesn't matter. A lot of organizations have it, but it looks something similar to this. So it's very small, it's easy to carry. It has a lot of information in it that it's only as good as the patient who writes that information. So yes, it's magnificent to have, but you as a patient need to take charge, and you need to write the lab results and values, and you need to write the medication. And if pulmonologist had prescribed a medication as a patient, you didn't write it in, and then you bring it to your primary care, who's Dr. Lamos, and he doesn't know, he can prescribe the same medication, and potentially you can now take the two medications together. So big assumptions. Please, patients, do not assume that every doctor is talking to each other. Don't assume that because you go to two different hospitals and they both have electronic medical records, that those electronic medical records communicate to each other. Don't assume, like Dr. Lamos said, that somebody's taking charge and somebody's calling and getting your lab results or medications or information. You have to take charge. I'm a very visual person, so the way I visualize is, if you visualize your body as puzzle pieces, and your lungs goes to your pulmonologist, and your eyes go to your optometrist, and your heart is your cardiologist. Primary care doctor is the one that can put all the pieces together. But you're the person that has the box or the bag with all the pieces. So if you don't bring those pieces to your primary care doctor, who really should be the quarterback of your health, then he or she cannot really help you. In terms of question, if the primary care doctor is not equipped to maybe manage sarcoidosis, and he or she might be feel more comfortable for you being treated by a pulmonologist, don't forget that you still have and may have other diseases. There are diabetes, there are heart disease. So don't assume just because you're going to see a pulmonologist who is a sarcoidosis specialist, then that's all, and you don't need to see your primary care doctor. Primary care doctor can do a lot of other things in terms of your prevention of other disease to make sure that you're healthy and happy.
Dr. Lamos, could you follow up on that a little bit? What you'd like to add to the role that a general practitioner can add to maybe help a patient navigate the web of specialists out there?
Certainly. Again, it depends very much upon the skill set of the doc that you're seeing and his familiarity with taking care of long-term chronic diseases. Much of what we talk about with sarcoid is also much of the same discussion we would have with taking care of other severe chronic illnesses. Depending upon the structure, there's a big difference from Almont, Colorado compared to Baltimore, Maryland, compared to New York City to elsewhere. You have different types of resources available that the primary care doc may be able to utilize. Communication with specialists and transfer of information is the number one thing to reduce the cost and complications of taking care of this disease. If one starts out with the premise and the patient takes the responsibility of assembling data and carrying them from place to place, many of the problems that you have heard about in terms of timing, how long it took to make the diagnosis, et cetera, will be minimized. I believe that if you use a record like this, or even a book that you assemble for yourself, and ask for copies of every test that you have performed and bring them with you and put them in a chronologic order so the doctor can take these data and scan them into his own record or make them part of his things, your care will be better. To take the role of a GP and minimize it is not correct. The GP or internist or family practitioner, however we think of those terms, can really be a great asset, because what we ask of our specialists is to help us manage the treatment and further follow-up of your disease. If the diagnosis was not made satisfactorily, we need the person that has the greatest impact on the symptom that you're having to help make sure that all the appropriate tests are done so that something doesn't slip through the cracks.
Irina, are there tools out there that people can access and should access to help coordinate their care?
Sure. So a book is probably the easiest and probably the most benefit for people that are not technologically savvy would be the book. But I would certainly suggest electronic personal health record. There are a few companies that do it for free. I personally tried and used Microsoft Health Vault just to see how it works. It's very easy to use. It's user-friendly. Again, it's amazing in terms of, you can download your lab results and you can download your imaging, but it's only as good as you as a patient and the information that you physically, type in there. To Dr. Lamos' point, if you get a book or electronic medical record, try to keep it relevant. When you see your primary care doctor and you have this, 15 minutes with the doctor, you don't want doctor to spend 10 minutes of it going through your labs from today until 5 years ago. What you need is to be relevant. You need to bring things that are timely, and you need to bring things that will help your general practitioner to manage you better. Another thing I want to bring to attention is that it's probably the most exciting time to be sick because there's so much available nowadays. Think of 20, 30 years ago where sarcoidosis was a word and people didn't know, and now we have specialists and we have microspecialists. We have pulmonologists that are specialized in sarcoidosis only. Because your general practitioner sends you to see pulmonologists, and pulmonologists then maybe refer you to see sarcoidosis specialists, don't assume that everybody's talking to each other. Make sure you get your labs, your imaging studies, your test, everything that was done, get a copy of it, bring it to your general practitioner, and make your time with your doctor valuable. Remember that the more time the doctor is going to spend looking for records, searching for records, calling the specialist, asking questions, the less time the doctor is going to spend with you, with really going over your care and strategizing. What's the next plan? What's the next step? You don't want to just keep coming every month for an appointment to go over the same thing over and over again. You need to start asking questions, write your questions. And don't forget, your question always going to be, what's the next step? What are we going to do next appointment? So start thinking in the terms of, this is your health, this is your body. People are, doctors are helping you care for your diseases, but ultimately you're the one that's responsible. So keep the information relevant and timely.
Dr. Lamos, someone's been diagnosed. How do they prepare for that first appointment?
That's crucial. I think every one of us has the memory of the doc walks into the office and his first question, says, how have you been? Well, I wanted you to change the paradigm so that you just don't say, oh, everything's been fine or everything's been bad. What I want you to think about is, Dr. Lamos, let me tell you what's happened since I saw you last. I saw the eye doctor. He reviewed my eyes, and he believes my eyes are doing well. I saw the dermatologist. The skin rash that was being treated with the steroid cream is doing well or not doing well. I saw the pulmonary physician last month that he tapered down my steroids and I'm doing better on those medicines. Or maybe he says, I've not done so well and he's changed my medication. Then the next statement should be, I've had this testing done since I saw you last. This is very much like the other question that said, what has happened to me since the last time you saw me? If you are lucky enough to be part of a system that is truly functioning in this new healthcare era, a lot of this will have been compiled for you. There's a button that the doc could click and it'll say, since I saw you last, all of this will be displayed for him. But if you live outside of a geographic area, like Baltimore or New York or whatever, you will have to do that job for him. But that's the number one thing you should do, Steve.
And what should you expect after your first appointment or from your first appointment?
Clear, concise orders about what should be done at the moment you terminate the visit, a clear time about when we are to follow up, what should be, if a test is ordered, will I hear from you and when? It's not, if you don't hear from me, everything's normal. The answer should be, you will hear from me, and give a timeline as to what. You should expect that discussion also would be, I will share these records with these doctors that you've listed as your panel of physicians.
Irina, are there other healthcare factors that should be considered when someone is diagnosed with sarcoidosis?
this question is probably more directed towards Dr. Lamos, but I can tell you that there are in healthcare industry, there are things that are available for people that with sarcoidosis or any complex medications. And many health insurance agencies right now, companies have what's called patient-centered medical home program, where they employ nurses or social workers or patient navigators to help with complex patient care. It's completely free for people that do have the insurance. Sometimes you do have to qualify. And those people are wonderful in helping kind of navigate through, insurance and different cares that are provided. There are also patient navigators, people that work in different organizations like foundations, and I know Sean will speak a little bit about that, but foundations are great in getting help with patient navigators who can help you. Support groups are tremendous help for people that have sarcoidosis. And just because you went to one support group and maybe you didn't like it, keep in mind that support groups are run by people just like you and I, and we don't always maybe click personality-wise. So just because you didn't like, and I heard that from some of my patients, I went to a support group, I didn't like it. Maybe you didn't like the support group that you went to. It doesn't mean that the idea of support group is fantastic. You can talk to people that have the similar disease, the same disease. They can hold your hand. They can work through the journey with you. And a lot of times they also have free help that it's available for people that are newly diagnosed or just have complex disease.
Dr. Lamos, how do you as a physician manage the care for a patient when they've been diagnosed with sarcoidosis?
Yeah. It's a lot of work to do it properly. First of all, to just say I have sarcoidosis isn't enough. It's sarcoidosis with eye disease, sarcoidosis with pulmonary involvement, with or without fibrosis. I must be crystal clear about the degree of involvement of each of the affected organs. So the note process and even how you keep track of the records, it has to be very precise. These are not the notes of the past. They have to be specific, and generally they are established evidence-based guidelines. These are words that you're going to hear thrown around in anything you read, but the evidence shows that if you have the records done properly and you've established follow-up properly, you minimize the side effects of the medication, you maximize the positive outcome for the patient, and you reduce the cost to the patient. None of which, I should say, all of these are incredibly important as for the people that are unlucky enough to have sarcoid that is active and multi-system. This is a long journey that requires people to be very precise and very thoughtful about all of these aspects of care.
Sean, let's bring you back into the mix. What resources does the Life and Breath Foundation offer to patients and their families?
It's a great question. There's the more, and we've been doing this 17 years in terms of raising the awareness of sarcoidosis and trying to help patients from all across the country. A lot of what we've found is the patients are by themselves. Their family members want to support them, but they're unsure of exactly how to do that. So one important activity that we've had is to make sure they understand that they're not by themselves, that we are there available to be able to help them with obtaining the correct information about what is sarcoidosis and possibly what the next steps should be to kind of reach out to your medical professional, reach out to your specialist. Because sometimes when you go online, it's scary. We're not sure about the information, if it's valid, if it's not valid, if it's a bad circumstance. So I think that's a very, very important part of what we do. I think developing platforms such as this webinar to be able to communicate to the patients and their families and being able to listen to the professionals, talk about different circumstances. And one of the things that I think is very, very important is coordinating care, navigating care. And to be able to put together certain resources to be able to do that in a paper form, in an electronic form, and maybe to help people that this is new to them, they're not sure exactly how to do that, but to be able to help them with the necessary steps to accomplish that, I think are other resources that we can bring. And every day we talk to patients and we invite patients to reach out to us, but we are looking for ways that we can help you, whether they're financial, whether they're educational, any number of circumstances.
Dr. Lamos, what would make it easier for you to be able to help your patients?
Sure. Well, I think many of the things I've just said are my personal wish list, that I could get people with chronic illnesses to come in so that I could give them better care. I think the other thing is for a patient to feel empowered to ask me any conceivable question regarding their disease. If they go out to the web and they've read something or they have a question, they should feel perfectly comfortable, because the relationship has to be a cooperative relationship, not a doctor telling a patient. We should be working together for your health. That is the new paradigm. It's not, I'm doctor, you're patient. We need to work together to help you get the best outcome. So the things I talked about with the book, the electronics, the communication, please communicate to me what you're wondering. Don't hold it back. For gracious sake, tell me right away what's on your mind. If we deal with those issues as they come up, my life is easier.
Irina, is there help out there from insurance companies or other entities that can be useful?
Right. So insurance companies have patient-centered medical home programs, as I discussed before. One thing that most of insurance companies are going towards is to have a patient portal. So many insurance companies do have a patient portal right now that you can register and log in on a day, moment notice. Some are unfortunately as simple as just the claims. So at least maybe if Dr. Lamos would ask, Irina, when was the last time you saw a pulmonologist? And I didn't remember. I can at least look up, based on the claim and say it was in March. But some are pretty magnificent in the way that they have doctor's notes and they have lab results and medications. So I would encourage everybody to register and log into their health insurance member portal to see what's available. There are, in hospitals, there are the ones that have electronic medical records. They also have patient portals. So if you're, unfortunately, were hospitalized, please utilize hospital member portal, because you can pull a lot of information from the website, and that's going to make it a lot easier for your primary care doctor to navigate through your healthcare. Because everybody is into reducing potentially avoidable readmissions, many hospitals now have programs such as ours, Transitional Care Program, where they hire nurses or community health worker or social workers to help people that were unfortunately hospitalized to avoid rehospitalization. So utilize the programs there. It's not as important to know the name of certain programs. What's important to know that there's help is available, and every hospital have discharge planners or case managers. Ask them, ask the nurse that's taking care of you. In terms of primary care doctor, I couldn't agree with you more, Dr. Lamos. It's very important for you as a patient to feel comfortable with your doctor. It's also important that the hospital that you like to go to is that your primary care doctor possibly has privileges too, so they can maybe visit you, or every doctor can call a hospitalist and find out your information. But if the doctor that you see has privileges in a certain hospital that you like, it makes it a little bit easier. And again, you have to like your doctor. You have to be comfortable with your doctor. Doctor is your quarterback. Doctor is your primary care doctor, is who keeps all the pieces together. But it's probably just as important, and Dr. Lamos, correct me if I'm wrong, is for you as a patient to feel comfortable with your doctor's staff, because most likely you will be talking to the staff more than with the doctor. So does doctor have, if you call an office and you get hung up on, that's probably not the best office for you to be. You utilize staff in doctors' offices. Many doctors have referral coordinators. We all want to be independent, and we want to say, don't worry, Dr. Lamos, I'll make my pulmonology appointment myself. But if Dr. Lamos has a referral coordinator, not only that she can, shake and move things to make sure that you're being seen on timely matter, but she'll also know what documentation you need to bring, what documentation does she need to send to the pulmonologist. So when you go see your specialist that your primary care had referred you to, they have all the paperwork necessary for you to be seen. Again, remember, you're a consumer, and your time with the doctor is very valuable. So you don't want to spend 5% or 50% or 90% of your time with the doctor on things that could be taken care of before. So make sure that you utilize the staff. It's complex. The sarcoidosis is, could be very complex disease. It's important to be comfortable with the doctor, and if you're not happy, it's better to find somebody that you'll be happy with, and then you'll have a good communication with. And when you're looking for a new doctor, and you call the office, find out what the coverage is. If doctor goes on vacation, who's covering you? Do you have same-day appointments? That's very important. There's still doctors out there that do not have same-day appointments with disease like sarcoidosis, and it's allergy season, and you feel like the flare is coming up. It's so important to call and say, Doc, can I be seen today? Because you can prevent flare-ups by starting treatment early. So make sure that your doctor has a same-day appointment. Ask what the routine appointment wait is. So if you need to be seen on a monthly basis and your doctor is booked for 3 months in advance, that's not the best place for you to be. So ask what the routine appointment wait is. Ask if they have same-day appointment. Ask what their affiliation with the hospitals are. Ask what staff works there. Do you have a referral coordinator? Do you have somebody that can help me manage my medications? So that's very important, and that's all in our hands. And sometimes patients feel defeated if they don't have good communication with the doctor, or they don't have good relationship. They don't want to see the doctor. That's more harm than finding another doctor.
Sean, how much research is being conducted, and how's it being funded to research sarcoidosis?
I think that there's research being done at some very, very quality medical facilities throughout the United States, throughout the world even, such as various places here in Baltimore. But I think what is lacking is the funding of that research. Some of the funding is government supported, possibly through the National Institutes of Health, but a large majority of it is private. But there's not enough of that private support out there. There's quality needs for that research. Johns Hopkins is working on a blood test that from a diagnostic standpoint will condense down and give the physician the ability to recognize sarcoidosis faster. It's less invasive. There's clinical trials that they would love to do, but again, that funding is needed to be able to do that. Some of that funding would go towards providing guidelines to primary care physicians to be able to more consistently diagnose our disease, sarcoidosis, in an efficient manner. But again, Steve, it's a big, big void, and again, that's one of the things that the Life and Breath Foundation has been trying to do over the last 17 years, is try to fill some of those gaps, and we invite other companies, corporations, families, and patients to join us in that effort also.
Let's bring in Dr. Edwin Chen now, joining us from Johns Hopkins Hospital.
Hello, Steve, and thanks for including me in this very important discussion today. It's a pleasure to be here with all of you today.
Dr. Chen, Google can often be our best friend and sometimes our worst nightmare when conducting research. What would you say would be the best way to conduct online research?
So, Steve, that's actually a very important question. I mean, nowadays, certainly most doctors will find that many patients will come to clinic having, scoured the internet essentially for whatever information they could find. There's certainly a lot of good information on the internet, and some that not necessarily is bad, but could be maybe not as objective as what we would hope patients might hear. I think probably the better websites that patients might look for information, particularly regarding sarcoidosis, they may certainly start at, I think PubMed was sort of mentioned. That's basically a catalog of all medical and scientific research papers. But also many of the national, international, medical societies would probably also have, rather objective information there as well. Those sites might include the National Institutes of Health, particularly the NHLBI, the National Heart, Lung, and Blood Institute, which focuses on lung disease and certainly has a webpage devoted to sarcoidosis. In the United States, the American Thoracic Society also has webpage and resources related with sarcoidosis and other lung diseases. American College of Chest Physicians, or ACCP, might be another source that could be useful. Outside of societies, there may be some other websites that patients might be able to find additional information. For example, not to single out any one of these, but Medscape and WebMD, sometimes might be useful. They may, particularly if they have more than one listing for sarcoidosis, certainly check to see, who the author, is behind the summaries or recommendations.
Dr. Chen, what are the latest research developments on sarcoidosis, and what new information do you think could be useful and helpful to patients?
Well, so as you know, much of sarcoidosis research is focused on trying to determine or trying to figure out what causes it, and certainly what causes each patient to have what seems to be a different course of sarcoidosis than others. And so I guess more recently there has been an attempt to try to study a larger number of patients with a variety of different presentations of sarcoidosis. And that refers to the multi-center grad study sponsored by the NIH. Although it's currently we're getting close to finishing recruitment for the study, the hope with this study again would be to gather a total of 400 patients with a wide variety of sarcoidosis, largely focused on lung disease, but also targeting patients who have multi-organ disease, cardiac sarcoidosis, and patients whose sarcoidosis seems to disappear, they having remitting disease. And the question would be, are there factors? Can we identify factors that seem to help predict, which patients might have one type of presentation or another? And so with the grad study, as part of the study, it was sort of a multi-modality approach to try to integrate genetics as well as some biological samples to try to answer this important question. And another thing I would mention too is that although the grad study is more of what we call a informational study or a historical study in terms of trying to understand the disease better, and not necessarily what people might think of as a clinical trial. Many of these research studies, particularly if they have funding by the NIH, would be listed on the clinicaltrials.org website. And so that's another way that patients might be able to keep in touch with active research projects, including ones like the grad study where it's not necessarily a treatment study, but one meant to, where the goal is to try to understand the disease better.
Are corticosteroids still the go-to medicine, Dr. Chen?
So, Steve, that's a very important question that we are asked about a lot in clinic. As you know, active inflammation, or when we say that sarcoidosis is active, we mean that the inflammation behind this disease is active. And we still feel that active inflammation, be it from sarcoidosis or other inflammatory diseases, will always respond to an appropriate dose of prednisone, a corticosteroid. And the important issue here is that that what we mean by an appropriate dose would be a dose that's certainly high enough to control the active disease, the active sarcoidosis, but a dose that's not unnecessarily high, where essentially you would be increasing the risk or the chance of developing side effects from the medication. It's important once a patient is treated that they continue to work with their doctor to find that appropriate dose. What we mean by an appropriate dose, just to give some round numbers, would be that many patients, particularly if they have lung disease, we might expect their disease to be controlled with a dose of prednisone somewhere between, say, 10 to 20 milligrams a day. So for those patients who seem to only remain stable with a much higher dose of prednisone, say 40 to 80 milligrams a day, usually their doctor will run additional tests to make sure something else is not causing this to happen. For example, an infection. And also in some other cases, it may be important for their doctor to look for other problems, such as either a heart problem or, say, sleep apnea, that again may be causing patients to feel much more short of breath than, say, what their mild lung disease should be causing them. So, and on the other hand, there certainly are patients who do have obvious signs of lung scarring, fibrosis on their chest X-rays and CT scans. And for those patients, we have to keep in mind that scarring causes permanent changes. And so lung scarring can also cause cough and shortness of breath that really won't get better no matter what dose of prednisone the patient is taking. And so in this last situation, the trick is for the with their doctor to really try to figure out whether or not there is some amount of active disease still hiding behind their scarred lungs. So to be clear, what we mean is that in most cases, of sarcoidosis affecting the lung, a dose of prednisone, a reasonable dose of prednisone between 10 to 20 milligrams a day is still felt to be an effective treatment for sarcoidosis. And then it remains important for patients to work with the doctor to make sure that they're on an appropriate dose. So one that's dosed high enough to treat their active disease, and but a dose that's not unnecessarily too high, where essentially there would be just increasing the chance of having side effects.
Patients typically don't like prednisone. Is there anything else that can be used to be effective?
So that's another question that comes up frequently for patients that are new to or are newly referred to our clinic. So certainly there are other medications other than corticosteroids that can be used in certain situations for patients with sarcoidosis. One thing to keep in mind would be that corticosteroids, including prednisone, remain the first choice for treating sarcoidosis. And it's because, we know that when dosed properly, that sarcoidosis always responds to an appropriate dose of prednisone. Most of these non-corticosteroid medications, basically medications that suppress the immune system other than prednisone, most of these medications work perhaps less than 50% of the time. So they're not felt to be either as effective nor as reliable as corticosteroids, and probably are not the best choice to use, particularly in a patient who is first starting their first treatment for their sarcoidosis. And unlike prednisone, where blood work safety tests are almost not required for most cases, most of these other medications do require blood work monitoring once a month, particularly in the beginning. And so, in most situations, prednisone still remains a medication that is both effective and reliable, for the treatment of sarcoidosis.
We're often focused on reacting to the latest symptom. Are there things that can be done proactively to help find better treatment?
So Steve, I guess to address your question, there are probably two avenues of thought. One way that patients seem to answer this type of a question would be essentially, is my sarcoidosis being treated appropriately, or does my sarcoidosis need to be treated? And particularly if that patient also is being managed by local physicians that might not see very many cases of sarcoidosis, then probably the best way of addressing that would be to see if the patient can be referred, even for just a consultation, to a medical center that does have an existing sarcoidosis clinic, where many cases of sarcoidosis are seen on a regular basis. Just so at these centers there's at least some experience in terms of evaluating patients with sarcoidosis, not just whether or not they have sarcoidosis, but also lending an assessment as to how active the sarcoidosis is. And essentially, as you know, depending on whether the sarcoidosis is felt to be active and where it is, what parts of the body it involves, that obviously will have a direct impact on whether to treat, how aggressively to treat, and perhaps sometimes even what medications to choose. And so, across the United States, there certainly are some sarcoidosis clinic, obviously at Hopkins, in New York City, and at Mount Sinai, Cleveland, and San Francisco, just to name a few areas. But many patient organizations, like the Life and Breath Foundation, will have, I think, keep lists of sarcoidosis clinics, or at least practitioners, doctors that do have an ample amount of experience seeing and evaluating and treating patients with sarcoidosis. And so that's another way of sort of like, tapping into that. And the other way of answering your question in terms of how patients can find the best treatment per se, would be to, basically keep a tab on active research projects. And again, one way to try to for patients to find what active research projects there are, particularly ones that might be involving research on how to treat sarcoidosis, would be the clinicaltrials.gov website. And there, again, the focus would be a little bit different than, say, making sure the patient's on appropriate standard treatment. But if the patient is interested in trying to further our understanding on what new treatments might be either available, then seeking out a research study with an active trial might be the way to go in those cases.
How can a patient that's diagnosed with sarcoidosis maybe alter or manage their lifestyle to handle the disease better?
Right. Many patients come with questions regarding what they can do to improve their situation with dealing with their sarcoidosis or managing their sarcoidosis. I think the first thing, as I mentioned before, regarding medications, and obviously it's important for patients to continue to work with their doctors, even just for the basic reason of trying to make sure that they're on an appropriate dose of their medications, doses that are useful to make sure keep their disease under control, and also making sure that the doses are not excessively high or higher than they need to be. Another type of question along those lines would be, patients ask about, what they should be eating, essentially questions related with diets that might seem to modify or change how their sarcoidosis might behave. Unfortunately, at this point, there really aren't any, research studies that support any one diet over another for either sarcoidosis or chronic inflammatory diseases, and so then really can't offer any specific recommendations along those lines. However, for all patients with sarcoidosis, whether or not their disease is active enough to require treatment with medications or not, basically all patients should basically try to remain as active as they can and live so-called healthy lifestyle. And what I mean by that would be that, essentially most patients, all patients really should be trying to, remain active and essentially exercise regularly. And it's, although it maybe seem like common sense to most people, what tends to happen in a lot of patients who, suffer from active sarcoidosis is that, they often stop participating in their regular activities when they get sick. But then on the other hand, once they are better, they find it actually very difficult to resume either exercise or their previous activities. And one important reason for this would be that they've become very deconditioned, a fancy term for becoming out of shape. And, this deconditioning becomes an important issue. It actually becomes an additional hurdle for these patients to overcome, in addition with dealing with their sarcoidosis. And so, and the other way to think about maintaining physical activity would be that for patients who are able to exercise regularly, essentially what they're doing is they're testing, a few times a week what their lung function is like, essentially what their breathing is like with physical activity. And, I think many doctors feel that for patients who are able to exercise regularly, and basically, testing to see what their breathing is like a few times a week, this, we think that this allows many patients to maybe detect changes in their health status or changes with their breathing at an earlier time than, say, compared to patients who are not as active on a routine basis. So that's another, sort of way of monitoring how well patients is doing. If they're able to exercise regularly, perhaps they can catch some changes earlier than other people. For those patients who are unable to exercise regularly, then it would be very important for them to, seek a physical therapy program. And specifically for patients who have advanced lung disease from sarcoidosis and who are also unable to exercise regularly, then what they probably should do is look for an appropriate pulmonary rehabilitation program to basically try to get them started.
What is the role of your foundation in helping to provide research and also patient support?
I think our role is to be an advocate for the patient, to stand out in front, provide the broad shoulders. We have some other foundations here in the United States that are doing a wonderful job. But I think what we would need is we need the patient's help. We need their family members' help. If they are affiliated, connected with different companies, corporations, I think getting them to support and get on the bus would be very, very helpful.
Do you have a vision for your foundation moving forward?
A vision would be We have an annual gala each year in September called the Flip Flop Festivus. We partner with the Four Seasons in Baltimore to be able to provide an opportunity to expand the awareness, to give patients an opportunity to meet other patients, other family members that have the disease, again, fulfilling our objective to say you're not by yourself. A great goal for us this year would be to raise $100,000 this year, just in the ability to put forth some of these programs, to put some of that money towards research. Long-term goal over the next 3 years would be to raise $350,000 to be able to give such organizations such as Johns Hopkins and other research facilities the ability to put some of this work together.
Doctor and Irina, is there anything that you'd like to add to the conversation?
Well, the only thing I probably would like to pitch is for the idea of systematized medical care that is across the spectrum. Patient-centered medical home is a concept that is not yet uniform across the country. It's the idea of all of these things being integrated in one place so the patient doesn't have to go through all of these discussions that we've just had. It's not common yet, and not every place uses patient-centered medical home to its complete end for the patient. Seek out in your communities places that are progressive and have a system of medical care. Individual physicians can provide wonderful, wonderful care, but I think as you go forward with complex diseases, you may find that a system of care will be able to fill in those pieces for you and decrease the likelihood of something falling through the cracks.
Irina?
And I can say take charge. Take charge of your health. Your primary care doctor is going to be your quarterback. You have to be a quarterback of your health. Don't assume that everybody is communicating with each other. Take charge of your health. And I can tell you, I've been doing care coordination for years, and I've helped primary care providers in establishing patient-centered medical home. And I naturally assume that because there's so many tools available for primary care doctors in patient-centered medical home care coordination, there's going to be as many, if not more, available for patients. And I was astounded to say that there's really almost nothing that's available for patients. I contacted NCQA, which is National Committee for Quality Assurance, and AHRQ, Agency for Health Research and Quality, and I asked them if there is any tools for patients to coordinate their healthcare. And to today's, I heard zero response. So things that Sean, that your foundation is doing is fantastic. You as a patient, take charge of your health. Get in touch with your foundations, with community support, with groups. Try to get plugged in, as Dr. Lamos said, to maybe larger systems that they do communicate with one another. And I wish you good luck and good health and speedy recovery.
Thank you all so much for participating in this very important and educational webinar.
Thank you
Thank
for
you.
inviting us.